Health Check with Nurse Jen is presented by Island Cancer Center.
Half a day, I'm Nurse Jen. Almost 80% of adults suffer from foot pain at some time in their lives. The average person on an average day will subject their feet to several hundred tons of force. And with one of the hardest working body parts, the foot has 26 bones, 33 joints, and over 100 different muscles, ligaments, and tendons connected to it. Fortunately, there are indicators that you can watch out for to prevent long-term foot complications. First, let's discuss the neglected heel. If your heel constantly aches, swells, and has stiffness, you could have a common diagnosis known as plantar fasciitis. This is a thick band of tissue that connects to the heel from the base of your toes. With the aging process, the tissue can develop micro tears, especially if you're on your feet for several hours during the day or you're an avid runner. Recommended non-surgical treatment include purchasing shoe inserts, splints, and avoid walking on cold ceramic tile floors. Other foot issues to consider and possibly seek professional help include yellow toenails. Maybe it's a mild nail fungus infection that can be treated with over-the-counter medications from your local supermarket. How about chronically cold feet? Maybe it's hypothyroidism. Hypothyroidism is a disorder in which metabolism is sluggish, and it causes the body's ability to generate heat, causing cold hands and feet. How about an enlarged, big, painful toe? Maybe it's gout. Gout is considered one of the most painful forms of arthritis that occurs when uric acid accumulates in the joints. You should stay away from red meat, organ meats, and beer. Do you have foot cramping? A common cause of foot cramps is dehydration or possibly an imbalance of electrolytes such as low potassium, magnesium, and calcium. The #1 recommendation by podiatrists include finding the perfect shoe. Dr. Hazen, podiatrist, found that almost 80% of his patients wore the wrong shoe size. He found many of his patients suffered from foot complications because their shoes were at least half an inch or more too small. Dr. Hazen recommended that consumers buy shoes half a size larger than their actual shoe size because as the day prolongs, feet naturally tend to swell. And as the feet swell, the toes become cramped, lessening muscle strength and movement, possibly triggering bunions and other foot disorders. I'm Jen Artero reminding you, don't wreck yourself, health check yourself. Don't change the channel. We'll be right back.
Health Check with Nurse Jen is presented by Island Cancer Center.